Hello, DADA2 community. We are here today with our friend Vanessa Rodber. She is a DADA2 patient in the UK, and she's going to share her story with us today about what her journey has been like living with DADA2. So, Vanessa, tell us briefly about your story. When did everything start? What does your life look like with DADA2?
So, we have two children, Zachary and Asley, age 22 and nearly 19. And actually, our story starts 22 years ago. From the minute Zach was born, he went straight into intensive care. And it sort of afterwards, he just kept having fevers when he was a baby, terrible abdominal pain, diarrhea, wasn't feeding. And I knew as a mother that instinctively that there was something wrong with him. But it took a long time for anybody to listen to me. It was about 6 months. And then finally, they did some bloods on him, and he had neutropenia, he had low immunoglobulins, and his liver function was very deranged. Anyway, very long story, but he ended up spending the next 2.5 years in and out of hospital. We knew all these things were wrong, but we didn't have a unifying diagnosis. Nobody knew what was going on with him. Thankfully, by the age of 3, after starting antibiotics every day, he got a bit better. And then my daughter was born, and the same thing happened. And then we knew this was a genetic condition of some sort, but we didn't know what. And so the same thing happened with her, 3 years of in and out of hospital. And so that was sort of 2004 to 2008. And then she got a bit better. And so the kids were quite stable. And then in 2015, when my daughter was 11, she became very unwell again with an overactive thyroid and myositis, which is inflammation of all her muscles. And then we spent 3 years chasing a diagnosis because she was so unwell, and she was in a hospital, out of hospital, nobody knew. And we were very lucky to end up with Paul Brogan at Great Ormond Street, who literally just took one look at her and just went, I think she's got DADA2. She was covered in the libido rash, which obviously the DADA2 community all know about. And then they started on treatment because they thought she was homozygous. And then the hardest bit came, because then they redid the genetic testing, and we were actually heterozygous, but symptomatic carriers. But at the time in 2018, it was thought that you couldn't have symptoms. So they withdrew Humira, which was really hard because she started to get better. Anyway, and then we spent the next few years fighting more. Unfortunately, in October 2020, I became unwell. So I'd been unwell as a child with low white count, anemia, but I kind of seemed to grow out of it. Nobody really took any notice of it. And then I'd had these vasculitic lesions on my feet for 20 years that I'd ignored. Kind of ignored. And then when my daughter was diagnosed, I knew what that was. And they did a biopsy. I said, yes, this is vasculitis, but we don't know what to do with you, because I didn't have any other symptoms. I was left. And then in October 2020, I ended up having 2 coronary artery dissections. So 2 of my little arteries around my heart blew and gave me 2 heart attacks. And I spent the next 6 months in hospital because nobody knew what to do with me. I got so ill, I couldn't sit up anymore. I was very lucky that we ended up being referred to Professor Jane at Adam Brooks Hospital, who's an amazing doctor and is not scared of doing things. So he just gave us anti-TNF, gave me anti-TNF and mycophenolate, and it's helped a bit. As he says himself, it's got me out of a hole, but it's not got me back to health. But we're working on that at the moment. So that's basically, it's just been 22 years of fighting to try and get some form of diagnosis, treatment. It's not easy.
Yeah. It's a pretty relatable situation for a DADA2 family or patient. Can you summarize that for someone who's never had to deal with a rare disease before? What would you say this process is like?
It's hard. Having a rare disease is really hard, because even now we have some form of diagnosis. We have a diagnosis. Nobody's ever heard of it. So every doctor that you see, and the multiple times you have to go and see other doctors, nobody knows. And initially, people seem to get interested and go, oh, that's really interesting. And then they all back off, and they all kind of don't want the responsibility of it. They all, so it's really difficult. I think, our lives are dictated by so much more else than just having a rare disease. We have treatments, we have to go into hospital, we have to go to hospital appointments. It's just like it's punctuated with appointments, with everything is just complicated. If you have a sore throat, a normal person just has a cold. With us, it's not just a cold, because we're all immunosuppressed. So therefore, you have to go to the doctor. You have to have blood tests. You have, it's a different dimension. It is difficult. It's just a continuous fight with everything that we do. But
Now, but by profession, you're a physician, right?
I am.
And so this is where the story gets, I hesitate to say more interesting, because it's already remarkable. But tell us from your perspective as a parent, a patient yourself, and also a physician, what does that give you? What perspectives does that give you in managing your family and you?
It's been an interesting journey. I think it's a journey that actually, it's got its benefits, but it's got its downsides being a doctor. I remember very clearly when my son was initially sick, and I remember being told he's neutropenic and his liver function was very deranged. And I remember seeing the results and thinking, oh my goodness, because I knew what those results meant. And I remember thinking, I wish I just didn't, because I think ignorance is bliss. And that was a really, sometimes you just think, actually, I wish I just didn't know. But anyway, I think it's a blessing, really, because I don't believe, I was talking to my husband about this last night, we don't think we'd be where we are today with treatment had I not been a doctor. Because I've been able to fight for my children, over the last 22 years, when we've been told, this is psychological. We've had all sorts of things over the last 22 years of telling, people not really believing us, not really believing everything that we were telling them. And that's been really hard, but it's changed me as a doctor completely. I think that's the one lesson that I learned was, my relationship with my patient was the most important thing was listening to the patient and making sure that they knew that I was, even if I didn't have the answers, I was listening and actually acknowledging all their symptoms. There is nothing worse for us that we found is walking out of the doctors and thinking they don't believe us. And that is the worst feeling in the world. And actually that made me understand that no matter what, we don't have all the answers. Medical professionals don't have the answers, but that's okay to admit that. But just tell the patient, I'm hearing you, I'm hearing what you're saying, and I will try and help you, to the best of my ability. And that's all we want as patients. We don't want anything else. We just want people to help us and acknowledge that.
So give another parent your insider knowledge. What are one or two questions or comments that they could ask their physician that you knew to ask as a physician?
I think, I'm not quite sure. I think, it's the questions that we asked. I mean, obviously my husband's not a doctor, so we kind of kept it quite low key. I think the questions that I asked, like things like prognosis, and that along that line, there are no answers. So I don't think I have any special questions to ask to help anyone, to be honest. It's just I'm just a mother and a patient that just ask the normal questions. I think what is helpful sometimes is the fact that I can understand, I can read papers, I can understand, not all of it, but a lot of what they're trying to say. And the doctors speak to me on a slightly different levels. They can go into things like cytokines and, knowing that I will understand. I don't think it's really that crucial that everybody kind of understands all that. It's quite complicated, and I find it complicated because I'm not an immunologist or a rheumatologist. But it's been an interesting journey, but it's definitely made me a better doctor. That's one thing that's come out of it, I think. Definitely.
Well, in a way that's encouraging to a patient or a parent to say, there's not some sort of special skill set for this.
No.
Questions matter.
Yeah.
Listening matters, all of the things you've mentioned.
Yeah, and it's right fight for what you believe in, you know, don't let anybody dismiss you, because you will be dismissed. I mean, that's a given.
So let's go to solution.
Yeah.
The foundation is looking forward to several things in the new year. One of the things we're looking forward to is building a patient registry. Can you give the DADA2 community a quick rundown of your understanding of a patient registry and what it can do to help both the patient and a clinician?
Yeah, so I'm absolutely humbled that Chip asked me to help to be on the committee to do that. So basically what we're trying to do is sort of have every patient in the world on this registry with their specific mutations, their symptoms, and very importantly, the patient's direct input into this, into their own symptoms, because I feel that a lot of us have very strange symptoms and very odd symptoms that we don't share with anyone, or we don't share with the doctors, because when we go and see the doctors, we are very aware they're time pressured and we haven't got the time. We feel that we have to tell them about what's most important. But I think there's lots of symptoms that are important that we just don't tell everyone. And I think that's really important, because what this is hopefully going to do is give somewhere where all the clinicians and all the patients can go and have a look and say, actually, I have this mutation and I have this symptom, and this is what treatment has worked for this patient. And if we build up, I think we have about 600 patients at the moment around the world, roughly. And if we have a registry with everyone's details on there, a pattern will emerge. And, you know, eventually we will be able to pick out things. Like I mentioned that in the last meeting, the DADA2 registry, that I think we should be putting in sort of other odd mutations that we're not sure of significance, because there's lots of mutations around that nobody knows the significance of. But this might be the key to why certain patients out there develop disease and others don't, and we don't understand why. And then the other thing is the DADA2 registry may be the basis for a natural history study, which, you know, will underpin further research into this and really help sort of management going forwards, and hopefully a cure. Mm-hmm. Fingers crossed.
Yes, yeah, it really is a game changer, I think, for where 100%. The disease. Yeah, and most rare disease organizations or researchers or whatever group is focusing on something like that do find that it really does change the trajectory of how we can cure the disease. Yeah. So the other thing we're excited about is a conference in 2023. You've been to one, correct?
Mm-hmm. Yes.
Tell us briefly about your experience and what someone can look forward to as a patient coming to the conference.
Okay. So I think, first of all, I think Chip was a genius in having the foresight back in 2016, only 2 years after this disease was discovered, to do an international conference and actually bring so many clinicians, scientists, families together, because I think that's been the game changer. I think that in itself, because it's so much easier to share information when you've met someone. So bringing all these doctors together, okay, they do all their presentations and everything, but they meet each other and that barrier's gone. And so if they need help, they don't feel that they can't email or ask. I think there's a lot more sharing of information that goes around from the doctor's point of view, you know, just over coffee, chatting. You know, I was involved in that in 2018, and you learn so much about what works and what doesn't work. From a patient point of view, it's amazing. So I was really lucky to be able to sort of do both, because my daughter was with me and she was in the patient and I was going backwards and forwards between both. We met incredible people, so many friends. You know, now WhatsApp groups were started. You can just text someone and say, have you had this? Have you, you know, and it's really helpful because you get real advice from real people who've gone through it. It's so inspiring to hear other people's stories. And it's an amazing community. The DADA2 community is amazing. It really is. And it's just amazing to put faces to names, Chip, Brenda, and now hopefully we'll meet in April if I'm well enough to come, all these things. It's an incredible event. It really is. And I really think everybody who can go should be going, because it's fantastic. It really is. But I think that's where every time there's a conference, something else comes of it. We learn new things, and therefore the treatment advances. It's just the sharing that goes on is incredible. It really is. And that's all down to Chip. So we're very, very grateful to him.
That's it. It really is. So I'm going to close with this. What are you hopeful for the future with DADA2? Whether it's the foundation or a little thing in your care, what brings you hope in all of this?
So I think, every patient's journey is different. And I think some people have had very smooth journeys. They've sort of, anti-TNF has worked really well for them. Others, not so much. And, sort of things are breaking through. My hope is gene therapy. I think that's not that far off, really. I think, we can be hopeful that may happen in the next 5 years or so. And I know, bone marrow transplant at the moment has cured a lot of people, but it's not without its risks. It's a big thing. Whereas gene therapy may be sort of a better solution for the rest of us, and more accessible. So, the hope is that this will come. I think there's a lot of research going on at the moment, and fingers crossed it comes through, and a lot of us will be cured. That is the main goal. And we just need, I think we all need to. I personally want to thank the DADA2 Foundation, because without the DADA2 Foundation, we wouldn't be where we are today. They have driven the disease management, the research, brought everybody together. And I think when you think of that, the disease was only discovered in 2014. We're 2022, 8 years in. I mean, the amount of research and progress that's been done has been unbelievable. And that is the DADA2 Foundation. So, very grateful, and we should all be supporting it and trying to see how we can help, really. But, very grateful to them.
Well, good. Well, this has been lovely to speak with you. Thank you for sharing your story. I know that it will encourage others, because that odyssey, that journey that you've been on, is similar to so many. And even if it's something that others can't relate to, it's one that you kind of have to say, okay, put me in, coach. How do I help?
Yeah.
Yeah, good. Well, thank you again. And hope your new year is wonderful. I know that we all are facing a new year, wherever we are celebrating and however we celebrate. And so I hope it's wonderful.
Thank you. You too.